Good afternoon, students and prospective patients. I am Professor Osur. Today, this is your first class in Introduction to Allergy 101, and we're going to begin with a pretest of a bunch of true and false questions. Now remember, this is a closed book exam and no Googling or surfing of the internet is allowed. Question 1. Spring allergy season begins in late March in the Albany area. True or false? The answer is true. Typically, spring pollen begins in late March and extends through April and May, and then we move into other pollen seasons as we go through the rest of the summer. Question 2. Is grass pollen the first culprit in spring allergy? I already gave you the answer to that. No, it's tree pollen, and the most prominent pollens in this area are birch, maple, and oak. Question 3. Bothersome spring allergy symptoms include nasal congestion, runny nose, sneezing, and itchy, watery eyes. The answer to that is true. Question number 4. Patients with seasonal allergies do not tend to have year-round allergies as well. That is false. About 2/3 of the patients with seasonal allergies also have year-round allergies to animal dander, dust mite, or mold. Question 5, true or false? In the United States, about 40 million people suffer from nasal allergies. The answer to that is true. About 40 million people do suffer from allergies in the United States. The next question, complications of allergic rhinitis include ear infections, sinus infections, and asthma exacerbations. Is that true or false? That is true. Uncontrolled allergic rhinitis can contribute to asthma, and also complications can include sinus infections and ear infections. The next question, the most important role that an allergist plays in your examination is taking a thorough history. The answer to that is true. Even though we do testing and we provide medications, the absolute most important thing is obtaining a good history to find out what the culprit of your problem is. The next question, true or false? The physical exam is always abnormal when you have nasal allergies. The answer to that is false. Many times patients come in, they're out of the season where their pollen may cause a problem, and they may have a totally normal exam. So again, the most important part of our evaluation is history taking. The next question, testing for allergies is an unpleasant and time-consuming procedure. The answer to that is false. Skin testing can take about 45 minutes to an hour. Much of the time is just waiting for the skin test reactants to show whether you have a positive or negative reaction. And if done properly, it really should be a painless or near painless procedure. The next question, true or false? Treatment of seasonal allergies should begin with institution of avoidance precautions. The answer to that is true. Whenever you're dealing with an allergy, the first thing to do is to uncover the source of the allergy and then try to prevent exposure. The next question, antihistamines and nasal steroid sprays are about equally effective in treating allergies. That is false. Antihistamines are in general much less effective than nasal steroid sprays if the nasal steroid spray is used routinely. And the final question, allergy shots afford significant relief of symptoms and reduce medication used to treat allergies. Is that true or false? The answer is true. If properly tested and the results are acted upon, allergy shots can reduce symptoms by upwards of 60% and reduce the amount of medicine you take by at least 50%. So how did all of you bright students and prospective patients of certified allergy do? Well, I suspect you did pretty well. But to improve your score, if you didn't do well, or to get relief, I would suggest that you come see us at Certified Allergy Consultants. Remember, the more you know about your allergies, the better you'll feel.